Juvenile Idiopathic Arthritis, JIA. It's also called Juvenile Rheumatoid Arthritis. So these are different names for different conditions one of our participants asked for. What's going on, Secoya Nation? Dr. Shilling bringing you today's Wellness Wisdom, and today we're talking about JIA, Juvenile Idiopathic Arthritis. So, give you a quick story. We had a participant come in, a lot of achy joints, young kid, migrating pains, right? So he's worried about, parents are worried about, doctors are worried about JIA, the idiopathic. I'll explain that in a minute. Can't really figure out the root cause of it. Doesn't know why this hurts this week and this hurts next week, and why do my joints hurt? You know, are these growing pains? We're trying to make sense of it. So what we found out was there actually was a medical doctor would have called it Lyme, but we're just going to call it arthropathy. You know, pain in your joints, arthritis, arthropathy, kind of pain in the joints. So what we did was we ended up helping his immune system overcome any inefficiencies and lack of energy and detox pathways, and balance out his microbiome so he didn't have any, self-devaluating conflicts related to his joints and things like that, which we'll explain in a minute. So if you like this video, definitely check out our Lyme real cause video. So I did this a couple weeks ago about the real cause of Lyme and the different stressors that are associated, because we all have the potential to create Lyme. It's just a matter of whether you do or not, or one of your loved ones does or not. So when a doctor calls something idiopathic, right? Idio, like it's like idiot. Like, I don't know the cause. So they're going to call it idiopathic because they don't have a root cause for it, which can be just basically described as any disease they're treating. They don't know the cause. They might blame it as autoimmune. Some people think JIA is autoimmune, but at the same time, we'll do another segment on autoimmune, so stay tuned so you get fully informed on that. So when you think about idiopathic, it's like they don't know what the root cause is, so all they do is try to manage the symptoms. Whereas when we take a step back and look at root cause, we want to understand how we can address the root cause immune imbalance so that people are actually getting helped and feeling better instead of just languishing and feeling like they're stuck with these joint pains. So when we think about JIA, Juvenile Idiopathic Arthritis, we're thinking about they're having a self-devaluation conflict. The child, because it's a juvenile, they're having a self-devaluating conflict because they feel like they're being oppressed. They're in an atmosphere of oppression. They're feeling like under someone's thumb, and it shows up. Like elbows, their inability to push back on someone. Knees are uncertain. You can't move forward. Hips are, I can't carry the load. Every part of your body has a story behind it, if you've heard anything we talked about. So this is how we approach human beings. Like, this might not be your jam, but if it's yours, we love it. So we're giving you our version of it because nobody else really has a decent explanation as to why it affects some people and not the others. So when you think about living in that environment of oppression, that you start devaluing yourself because you don't have a voice, you don't have a way of challenging things. Then you start becoming afraid of the dark. You start becoming afraid of your parents. You can't be taken away from them. You've got to stick close to them. You start having separation anxiety for some kids like that. They literally have to sleep in their parents' room on their floor because their brains are processing this, I'm afraid. It's a real thing. One of the metaphors is like hide behind your mother's skirt so you feel like you're protected, okay? But this self-evaluation, it happens on a daily basis. It's recurring, and that's why it turns up in the joints, because the joint pain, or another symptom in the body, is a disconnection between the brain and the body. When the conflict lingers long enough, the brain and body become disconnected, and that's when you start getting symptoms, because your brain is what perceives all the symptoms, all the sensations in your body. So if you don't interrupt that devaluation conflict and that oppression conflict, it's gonna persist. So it's like the child who feels like they're never good enough for their parents, or it could be like an athlete who never can feel like they can perform with their coach. It could even be, I'm not doing well at school, so now I feel like crap, and I feel like I'm not living up to my parents' expectations, stuff like that. And then it starts showing up in different places, right? It could be arthritis of the neck, criticism, stubbornness, inability to understand something. The body doesn't just break down for no reason. Okay, to understand the explanation. Your body breaks down specifically for certain reasons. When your microbiome gets imbalanced, certain microorganisms that live in our body normally can then preferentially sort of feast on that tissue because it's related to your brain-body disconnection. Okay, so for this little guy who had Lyme, we were looking at basically elbows and knees, some neck, some hip. Okay, those are pretty common. Some people get in their feet and ankles, just depends. And because of the feelings of imbalance, because of the feelings of he couldn't carry the load of the expectations, he couldn't push back on the expectations, he couldn't understand why the expectations were so high, or why they were never, i.e. the parents were never satisfied with the expectations being met. that was what oppressed him, and it could be a parent, grandparent, could be someone else, could be a teacher, coach, things like that. So that gives you sort of a broad spectrum understanding of how the brain-body is connected, what the real cause of JIA is, and it has nothing to do with a diagnosis of Lyme or anything like that. It's really about these stressors that show up in a certain individual, because not everybody experiences those things. So it's your opportunity to say, so how is my kiddo being affected by me, my spouse, school, a coach, something like that? That's your opportunity to figure out. So I really want to draw your attention to that, the real cause of Lyme. If you're interested in that, if this resonates with you, watch that. If this resonates with you and you know someone that has, or their child has JIA, share it with them. Give them a better understanding. Help have the tough conversation about the environment they're living in. Because the parent, look, trust me, I'm a parent. You don't always know what you're living in. You don't even know who you are half the time, because you're just, anytime you're past the age of 30, you're basically repeating yourself from the day before until you become aware of your pattern. So give yourself some grace, give yourself some compassion. You might not even know this is happening in your home. You might just be thinking, this is just what we do. Right? You might, well, this is what my parents did. I've heard that a million times. The point is, you get to now, if you're observing this in your child, you get to take a step back and say, how am I affecting my child? How is the environment affecting my child? Maybe it's my spouse, maybe it's the coaches, maybe it's the teachers, I don't know. But I'm willing to get to the bottom of this. Now you have some information on what to go address, and now's your opportunity. So that's your call to action. That's your next step, okay? So stay tuned for more videos that we're doing. I'll just say the next one we're going to do is on autoimmune, okay? So stay tuned for that, and we will look forward to seeing the next Wellness Wisdom. All right, guys? Have a good night.